Why does bile color change? Imagine your body as a busy factory, constantly producing and processing substances to keep you healthy. One of these vital substances is bile, a yellow-green fluid made by your liver. Bile's main job is to help digest fats, and it travels from your liver to your gallbladder, where it is stored until needed. When you eat a meal rich in fats, your gallbladder releases bile into your small intestine to aid digestion. Bile contains several components, including bile salts, cholesterol, and bile pigments. The main pigment is bilirubin, which is a byproduct of the breakdown of red blood cells. Bilirubin gives bile its characteristic yellow-green color. As bile moves through your intestines, enzymes chemically modify these pigments, turning the color from yellow-green to brown. This process takes some time, which is why your stool is usually brown. Now, the color of your stool can tell a lot about your liver and biliary health. If your stool appears pale, clay-colored, or white, it often means that bile isn't reaching your intestines properly. This can happen if there is a blockage in the bile ducts caused by gallstones, tumors, or inflammation. When bile flow is blocked, bilirubin doesn't reach the intestines, so the stool loses its brown color. Such blockages can also cause jaundice, which is a yellowing of the skin and eyes due to bilirubin buildup. Sometimes, stool can appear dark or black. This isn't directly related to bile color but often indicates bleeding higher up in the digestive tract, where blood is digested and turns dark. Certain foods and medications can also darken stool without indicating a serious problem. Green stool is another common change. It often occurs when food moves too quickly through the intestines, not allowing enough time for the bilirubin to be fully converted into the brown pigment. This can happen with diarrhea or rapid transit, and it's usually harmless. In the context of liver health and liver cancer, changes in bile color are important clues. Tumors in the liver, bile ducts, gallbladder, or pancreas can block bile flow, leading to pale stools and jaundice. Recognizing these signs early can prompt medical evaluation to assess liver function and detect potential issues. In summary, bile color changes are a reflection of how well your liver is producing bile, how smoothly it flows through your biliary system, and how your intestines process it. Disruptions caused by liver disease, blockages, or altered digestion can all influence bile and stool color. If you notice persistent changes, it's always best to consult a healthcare professional for proper diagnosis and care.